Hi, my name is Brenda Rojas, and this is week 2 journal. I just started my clinical rotation a week ago, so this last weekend was my second week there. I did not have a patient or patient interaction, which there was any transference, countertransference, or prejudices or biases or judgment. And so it is difficult to answer that question because I haven't had that experience just yet. My clinicals are in an inpatient psychiatric hospital here in Tucson, Arizona. So a lot of the patients I saw this week were very unstable. A lot of were psychotic, with a lot of psychosis. In the adolescent units, there was a lot of anger management issues, aggression. So the units were very, very unstable this weekend. I have not encountered transference, countertransference, or prejudice. Well, prejudice I have because of my color, of course, and because I'm Hispanic. But any of the above in the past, in my personal life, absolutely. Some transference has occurred, so I kind of knew what that word meant, or what it entailed. Now, if I had some biases or judgments or issues with the patient that I'd seen, I would have to kind of look at within and think if I'm in the right field, because I will be in contact with different situations, different diagnoses and disorders, and despite my beliefs, I am here to take care of the patient. That's what I've chosen to do. So I would have to really, really look to see if this is where I should be. In one of my videos, I'd ask, maybe what kind of type of issues I may have dealing with. Maybe some domestic violence would be an issue. Physical abuse on children probably would be an issue. But I've been an ER nurse for a long time, so despite that it might hit home a little bit, I still take care of the patients and just go on. I don't let it affect me. I don't take it home. I do what I need to do and I take care of the patient. I've also worked in the prison system, and despite what they're in there for, they're still a patient. And my job is to make sure that they got the healthcare, the healthcare that they needed. So I've learned over the years how to put that all aside and just take care of our patients for their needs. But if it were a time where I just couldn't, it just really hit me out, pretty bad, then I would absolutely ask a coworker, can you take this patient? For one reason or another. And then I would have to sit back and really, really, really take a look at what was going on, what was the issues, why I couldn't handle that type of patient. So I haven't had those issues just yet. Like I said, this is week 2. Maybe down the road, I might be able to answer the question. We did see groups of one group of 12, one group of 10, and I did some individual psychotherapy, one-to-one. A couple of the patients did talk to us, but one of them just wasn't having it. And so it's been very interesting for me, a new element for me as well. Like I said, I'm used to ER trauma, and so you just kind of take care of them and then you go. But looking forward to learning more, looking forward to seeing different cases and learning more about me, and how I can handle certain situations. This week's reading was very interesting in how you were able to, ask certain questions to see if the patient was having any suicidal ideations, homicidal ideations, and then just based upon what they were saying and how they were communicating, whether they were in a psychosis or not. Just the type of questions you could ask to draw out that information was super interesting to me this week as well. So looking forward to the next 8 weeks. Thank you.